Hello and welcome to all of you as you're joining. We're just going to give everyone a couple of seconds to get into the webinar and then we'll kick off. All right, well, let's get started. So good morning, everyone. Good evening, good afternoon, wherever you are. You'll probably see the sun come up behind me here in Washington, DC, where it's still rather early. But we have wonderful panelists joining us from all over the globe today. Welcome to the September edition of our Pulse on the Principles webinar series. And we're so pleased today to partner with the CDAC Network for this session. I'm Laura Walker-McDonald. I'm the Senior Director for Insights and Impact of the Digital Impact Alliance, and we're proud to be the stewards of the digital principles. I also have the great honor of being a board member and a longtime community member of the CDAC Network, which we'll hear about in a second. I do want to take a moment to thank the team, the CDAC team, for making today's event possible. And I'm really excited, I know a number of the panelists are as well, about having the opportunity to bring together two things that I really love, which are communications with communities in emergencies and the digital principles. I started out in humanitarian aid, actually, and since then I've focused on using technology in aid development and social change work. And having experience in both worlds, I've worked alongside many devoted practitioners of both communications with communities and the principles, but I found that they don't necessarily know each other. Those two groups don't necessarily know of those frameworks, even though they're very relevant to one another. In communications with communities and emergencies, digital technologies have long been part of the picture. And during COVID, remote communications are even more important. But awareness of the principles is pretty limited in humanitarian circles. On the other hand, the digital development community is beginning to understand more and more about how important communications with communities is, both as a natural evolution of their practice and also because of the increasing incidence and severity in recent years of global health crises like Ebola. I often see colleagues in that sector searching for resources that already exist in the humanitarian space. So by partnering with CDAC for today's webinar, we are hoping to fill some knowledge gaps and share some challenges and stories and discuss how those two concepts come together. There'll be much more than we can cover today, but hopefully we can start the conversation and continue on Twitter later. A couple of points of housekeeping for you. We've got a few questions that we've collected from the RSVP form when you signed up, and we've also enabled the chat box below for those who are live, so you can add questions as we go, and we'll take some of those questions later on. And then let's also, as I said, keep the conversation going after the webinar. We'll be sharing everybody's Twitter handles in the chat, and our Twitter handle is @DigiPrinciples, DIGI Principles, and CDAC's is @CDACN, CDACN. And so let me now introduce our guests. So Tan Sri Dr. Jamila Mahmood is currently the Special Advisor to the Prime Minister of Malaysia on Public Health and began her mandate in April 2020. She's also a member of the Government of Malaysia's Economic Action Council and is actively engaged in the COVID-19 response. Prior to this, Jamila was the Undersecretary General for Partnerships at the IFRC, the International Federation of Red Cross and Red Crescent Societies, from January 2016 until June 2020. Her other international positions included being the Chief of the World Humanitarian Summit at the United Nations in New York and the Chief of the Humanitarian Response Branch at the United Nations Population Fund. She's an accomplished humanitarian and well known as the founder of Mercy Malaysia, a Malaysian humanitarian organization that works globally. Dr. Jamila, thank you so much for joining us. We're really excited that you're here.
Thank you, Laura.
So Sandra Zerbo is CDAC's National Coordinator for Communication, Community Engagement and Accountability in Burkina Faso. She brings over 10 years of experience in the management of humanitarian and development programs. And prior to joining CDAC, Sandra worked in Kenya for Africa's Voices Foundation, an organization that uses digital spaces to put citizens' voices at the heart of development and humanitarian programming. Sandra has also worked for various organizations in Senegal, Rwanda, Iraq, and the US. She's a graduate of the School of Oriental and African Studies at the University of London. Sandra, welcome.
Thank you. Hi.
Hi. Finally, last but not least, Anahi Ayala Yakuchi is an independent consultant with over 12 years experience working in more than 40 countries around the world. She's managed and designed large multi-country programs, partnerships, fundraising initiatives, knowledge management systems and trainings, and has a specific expertise in the application and use of technologies for development and human rights. Her current work focuses on digital accountability and community engagement, which includes access and attitudes towards technology by local communities, as well as developing and assessing strategies to improve online inclusion and participation. And Anahi has definitely educated me very much over the years. Welcome, Anahi. Really glad you're here. So my first question actually is for Dr. Jamila, and I know that you're now in a position advising the Malaysian government, and we wondered whether you could share with us a little bit about how you've seen digital being used in humanitarian and health emergencies, and particularly how governments are looking at digital communication in the COVID-19 response.
Thank you, Laura. First of all, let me just say how excited I am that we have the principals. As someone who is a bit of a dinosaur, I think, in the humanitarian sector, we've been talking about this for the longest time. So really well done to everyone who's been involved. Now, we know that the digital space has now been more occupied with, communications with communities, from the traditional SMS system to now social media and so on and so forth. And I think that, we will see more of this. And I think this is a huge opportunity now for us to reach more and more people. However, we also know that through these channels, just as you can get feedback from people, there could also be a channel for misinformation. So it is a little bit of a double-edged sword sometimes. So that, we have to tread cautiously. And I think having principles, having measures to counter, rumors and misinformation is going to be key. But at the crux of the matter is really about building trust with communities. I think there is no other thing that is more important. And no matter what tool you use, if you don't engage with communities and you don't build that trust, then you will never really be able to have that relationship and the honest feedback that you need. Let me share with you a story, an experience from Malaysia. At the height of the COVID crisis here in March, one of the biggest problems we had was a religious gathering of 12,000 people in Malaysia that came from all over Asia. And of course, we didn't know that COVID was going to, for somehow they slipped through, right? And what happened was when they all departed, some departed the country, but also a majority were in the communities. And the way they behave is to go door to door to preach and so on and so forth. And therefore, it was really finding who were the interlocutors that they would be listening to, and how do you get them to come without feeling that they're going to be admonished and so on and so forth. So we actually had to turn to religious leaders and the Ministry of Religion to then use social media to inform people that don't be afraid, come forward, talk to us. We want to do contact tracing and so on and so forth. But we also brought in telcos, right, who understood, because all their numbers were recorded. How do you reach to them? And if you can't reach them, how do you get data to triangulate where they might be? How do you reach those communities? So what I'm trying to say is that even as a government, I think we have to be able to also look at these principles. What are the ethics behind collecting information and, being able to triangulate data? How do we actually leverage the private sector in a way that does not also breach, privacy and so on and so forth. So I think this is the beginning of that journey, and COVID has certainly exposed to us in circumstances where you can't really be with communities. You have to find an alternative way to be in touch and to receive that feedback. So local is key. At the end of the day, it is about localization, right? Now, one of the things I've been especially proud of is that we've managed to build now a coordination platform in Malaysia of government, NGOs, and the private sector. And one element that we're going to try and build in now is how do we build in community engagement on this platform and support the capacity development of not just NGOs, but also government and private sector. So, with these principles, I think we're just going to take this forward and see how we can continue the conversation.
Thank you, Jamila, for kicking us off so wonderfully there. Wonderful, and I think we'll return to some of those themes later on because there are questions about some of those issues that we've had from our audience. I want to turn now to Sandra. So many in the audience might be from the digital principles community and not actually have come across the CDAC network, the Communicating with Disaster Affected Communities Network, and the concept of communications with communities in emergencies. So I wanted to ask you if you could give us the update, let us know a little bit about the network and about CWC.
Thank you very much, Laura, and thank you to CDAC and DL for giving us this platform. I'm really honored and excited to be part of this panel. We really have to start with understanding the premise from which we're beginning the conversation. And this premise in terms of communicating with communities is that information and communication are crucial and are critical forms of aid in themselves. And going from this premise, we believe and we understand that in emergency situations, if people and communities have access to adequate, timely information, they are going to be able to, by themselves and for themselves, not only prepare, but also address the different crises and different emergencies that occur within their communities. So we go from that premise and we build different platforms, bring together different actors in order to ensure that the responses, that the voices of communities are at the start and in the middle and at the end of the different responses that we implement. And that is what CDAC tries to do. CDAC is at the moment a network that brings together UN agencies, INGOs, local NGOs, media development organizations that come together, collaborate, undertake research, share learning, build capacity of themselves and of the communities with the communities in order to ensure that within the humanitarian sector, the response that we bring with the communities, that we're stronger, that we're able to provide timely and accurate and reliable information that, as we said before, communities can use in order to make informed decisions about their lives and therefore better their lives. So it has to be said that from that premise, within the COVID-19 crisis, and especially in Burkina Faso, has been able to accelerate, I have to say, not only the efforts that government actors have been trying to implement in especially hard to reach areas, but also humanitarian actors and communities themselves. What we at CDAC have tried to do within Burkina Faso is to start to give support to the humanitarian community in order to collectively come up with a working group that is called the Community Engagement and Accountability Working Group that we've put together in order to collectively address emergencies. We have the humanitarian crisis that we're facing that has been exacerbated, I have to say, by the COVID-19 crisis, is now being responded to with tools that we're trying to collectively put together, collectively improve at the level of our working group, creating a platform that makes sure that synergies and collaborations are found, so that we have mechanisms in place that communities can use to give us feedback, that we can use also to close that feedback loop that has for so long been an issue where, Dr. Jamila was saying, we often really talk to ourselves and we don't, and we talk at communities. So it's really trying to close that feedback loop to make sure that collectively we're able to go and address this, not only the humanitarian crisis, but also the health crisis that has come to us with the COVID-19 pandemic. That's what I'll say for now, and looking forward to engaging and responding to questions as well. Thank you.
Thanks so much, Sandra. Yeah, I think there are, again, some more themes that I think we'll touch on later on. So Annie, I want to turn to you now, and you've had a career that sort of spans humanitarian and development, and you've been involved in the digital principles community for many years. And I have asked you to take on the role of explaining the principles for digital development to the entire humanitarian community. So, but please do also share any stories from your work that you think would kick us off beautifully here. Go for it.
Thank you. Actually, it's interesting because, yeah, thank you for the very easy task assigned. I think it was very interesting because when you sent this, when Mariam sent the invitation for this webinar, one of the things that got me thinking is that I think that the first conversation we've ever had about the humanitarian principle, the digital principles, was probably 2013, 2012 in Washington, where there was a very strong kind of like willingness from the ICT4D community, which at the time was called ICT4D community, to actually talk about these issues, because a lot of organizations were jumping on the idea of using digital tools, creating, I remember creating mobile apps, SMS apps, and whatever other app for humanitarian purposes, and doing it in a way that at the time, I think, a lot of us considered to be kind of like a bit reckless, right? I remember Haiti, I remember Chile, I remember after that, Pakistan. And I think that, I remember those conversations were really coming from the idea that there was a need for some principles that will inform organizations on how to actually build digital tools for good, for development, for humanitarian, for whatever the case it was. And I think that as much as it was absolutely needed 7 years ago, it is still unfortunately very, very needed today. So I think, how I would explain the principle to the humanitarian community, to be entirely honest, I would just say that the principle are what you use to apply a community-based approach to building digital tools. And it's very simple. Community-based approaches and human rights or rights approaches in the humanitarian system have been used now for decades, right? We say build with the community, we do participatory assessments, we do participatory analysis, we do participatory strategy planning and all of that. And I think that what the digital principles say, it's exactly that, is you design with the user, you understand the existing ecosystem, you design for scale, for sustainability, you're data-driven. So I think that there are, it's basically the same. It was funny when we said, why we've never put together these two communities, the communication with communities and the digital principles, because at the end of the day, you can implement a digital principle by using communication with communities approaches. And I actually think it's the only way you can apply digital principles is by involving the community within the way in which you build digital tools. And honestly, it's always, there's always a bit of a, how do you say it? It's like there's always a double sword when you're talking about creating principles. Because on one side, you don't want to tell people exactly what to do in every situation, and you don't want to give them prescriptive ideas of how every single technology needs to be built. Because let's be honest, if you are in an emergency context and something happens, and you have something available that you can use that was not built with the community, but that it's effective and works, you're going to use it. And that makes total sense. But most of the time, we know that that's not the case. And I think that the digital principles today with COVID-19 are showing how much of what humanitarian organizations thought they were doing in terms of applying and using participatory approaches to digital. I think that this crisis have made them realize that they were not actually doing it. And I think that in a way it is, if we want to call it, let's see the positive side, it is a positive side. It's like the digital, principles are here to provide support to organizations that right now have much less choices to decide which tools to use to communicate to people and how to do it. And the issue of trust that I think that both Yamila and Sandra mentioned, to me, is very much related to the digital principles. If you don't design your tools with your community, they're probably not going to trust the tool itself. If you don't, design something that it's sustainable, that is there with 10 users as much as is there with 500,000 users, then it's probably going to crash and nobody's going to trust that that system is going to work. I mean, it's as simple as that, right? It's like, if you don't involve at every single stages of what you do, the community in itself, you're not going to be able to do it. And, that is the base of communication with communities. And that is the base for how the digital principles have been created and thought through. So I think that the connection here is absolutely kind of like crystal clear to me.
Well, thanks. Yeah, I agree. I think it's, I've always thought of it as a way to not teach someone how to do something, but teach them how to think about how to do it and how to start having the conversations. We're, at the principles team, we're working on some resources this year to look at the principles through different lenses that I'll just mention. So thinking about them through a leave no one behind lens, how do they handle exclusion and marginalization? Looking at them through a responsible data lens, and how do they handle some of those tricky questions of long-term data management, but also ethics, and how do we think about participation and governance and things like that. So watch out through the year for those resources to start coming out. But thanks all of you for those really fantastic beginnings. And we've already got questions coming in from participants. And if you're listening or watching live, then do put your questions in the chat window and we'd be happy to address them. One has actually already come in, which came in a lot in the questions from the RSVP form. And I think it's a question that brings up two things. One, how are we seeing digital communications being used in this COVID emergency? I think all of you have touched on this, but we're seeing, you've also mentioned that there's more of it, it's more necessary, there is a change. But critically, how do you do that in a place where there is low connectivity and access to technology? Let's maybe start with there, and then I think we should also come back to this issue of trust that you've all mentioned.
Yeah.
So to any panelist that cares to answer, what are you seeing in terms of you doing CWC with communities in low resource settings?
Do you want
Jamila,
any one of us? Yeah. Well, first of all, I want to say that in Malaysia, although we are entering the high middle income country, we have about 24% of our people who don't have access to internet and in digital communication. They may have a cell phone. So I think that the stark reality is that are we talking only to the ones who we can reach, and whereas the most vulnerable don't have access to that those digital tools. So I think one of the things we recognize though is with even the basic smartphone, and one of the things that's very much used here is WhatsApp. So that's been a really amazing tool that people are exchanging messages on, or SMS, right? The basic tools. But that points to the very point that, can we actually rely on digital tools or digital communication when there's no resource? So it does boil down again to how do we actually prepare communities, and whether it's societies or governments, to actually build in some form of community communication even before a crisis. So, traditionally there are people who, communities where there's a community leader, there's a lot of, the culture of a country is so important. How do they communicate? How does a community make decisions? So this has been quite a painful sort of, a reminder to all of us that while we assume that we all have our mobile phones, that everybody has the same access, actually they don't. So we need to maybe, go back to reliable means of communication that people, will have, which is radio or television. So it's not one or the other. I think it's about how you find something that's customized for that particular community.
Yes, and if I, that is, Dr. Jamila has really put her finger on the thing there, where I was coming to that question. In Burkina Faso, where we talk about low resource, low literacy rates, and compounded by a humanitarian crisis where we have a very high number of internally displaced people who have left their localities of origin and have found themselves in places where they have probably had to leave. Conditions were already hard at the place of origin. They've had to leave with basically nothing to go to a host community. The thing that we've found that, and this is going to address the question that Denise asked in the chat there, how a lot of the members of our working group that are operating in the hard to reach areas have done is, first of all, really study the ways in which communities prefer to receive information, prefer to communicate amongst themselves and with others, with actors that are there to provide humanitarian aid, to provide also health care. And to be frank, at the end of the study, and I will mention a specific organization, Fondation Hirondelle, that is also a member of CDAC, that has done a study here to really address rumors, track rumors, address rumors, and also convey or transfer information to communities, affected communities in hard to reach areas. They've found that it's first within communities themselves. It's the neighbors, it's the friends, it's the community leaders, and then it's the radio. So what's been used a lot here in very hard to reach areas and resource poor areas is really the radio. The government has put together a working group on risk communication and community engagement as well. And the use of radio and TV in local languages, in addition to French, has been key here. So language has been really, really key. And being able to reach populations with the radio has been also key. Fondation Hirondelle with UNHCR and another organization in the Centre Nord called ICAD, they've actually gone so far as providing radio sets to communities, and their other organizations such as UNICEF have had radio programs as well, where communities could also, with a very simple phone, call into the radio to share information, call into the radio to give feedback, call into the radio to talk about what their experiences have been, what their needs are, what their preoccupations are. And next to that, communicating with communities has also been done with the help of community liaisons. And in this specific context, with both humanitarian and health crisis, it's been really challenging, but we've found that a mix of the more traditional ways of communicating, the right language, and the use of really basic phones has been very key in addressing the crisis.
Thank you, Sandra. Anahid, do you have something to add to that?
Not much. I mean, everything was just said. I think that the most important thing that I've learned in terms of organization now having to face this issue is that it's the issue of trust, and how a lot of my suggestion to a lot of organizations that are now trying to get in contact with communities, knowing that a lot of the communities are disconnected, is to really creating this kind of like trust by proxy mechanism, where you identify people within the community that can have access to those tools and that are trusted already by the community, and you use them as your main kind of information point, or as your main kind of like node within that network. And I think that that works better than try to do massive connectivity programs, or trying to bring in, mobile phones or whatever it is to make sure that everybody's connected and, able to go on the internet. I think that the relying on the mechanism already existing offline and trying to find the nodes that you can connect online, it's way more effective, especially now where we don't have a lot of time to kind of like sit and think about a strategic, plan on how to do this.
Mm. Yeah, and I couldn't agree more. I think I remember back in sort of 2010, late 2010, when there was flooding in Pakistan, and there was a lot of interest in doing text message based programs because we had just done a lot of that in Haiti, in the earthquake response there. And but actually there was very low trust in messages received by SMS, and it was much more likely that you would trust a message given to you by a community member or a someone who had some sort of religious connection with you, or even on the radio. And I always think of radio as being still the most widespread technology for communications that we have. But you also mentioned extension workers who might themselves have access to, or extension workers is a very fancy way of saying just people who maybe sort of go out and are community liaisons, as you said, Sandra. And they might be digitally connected and then passing on messages that are received in different ways. So it can be quite a network effect. But I wanted to really pick up on that issue of trust that Anahi raised, because I think it was probably the second most popular question that we had, which is interesting to see that coming through so strongly from the questions that we had before the session. How do you provide this life-saving information that helps with a massive public health challenge and deliver it in a way that is both effective and easily updated, and also elicits the response that you want and generates that trust? Jamila, do you want to kick us off?
I think let me share maybe the experience of the Red Cross, where, so with my previous background in the Red Cross, I think taking the example of the Ebola crisis in North DRC, one of the biggest challenges was mistrust, right? So people thought that, as usual, same thing with Haiti, that when you go to a treatment center, you're going to be given the disease rather than to be treated. And I think it was, I think, a partnership with a Novetta company that looked at all the social media messages, whether it was WhatsApp or Facebook or Twitter, and then being able to use basically big data analytics, right? And without any emotion in it, being able then to triangulate what was the messaging around, and therefore then using the Red Cross volunteers to go into communities and talk to them face to face, and then reassuring them or addressing some of the mistrust there. I don't remember the exact figures, but the initial number of percentage of people who went to the treatment centers was extremely low. And with this, being able to use the data from digital communications, and coupled with trusted community members who are volunteers, that was, eventually I think they had 85% rates going to the treatment center. So it does work. A combination of understanding the data to coupled with finding the people they trust to be able then to address some of the miscommunication or misperceptions and the rumors that were circulating.
If I may, Laura, ask a follow-up question here to Dr. Jamila. What has been your experience in terms of the government's involvement in this, like the messaging that has come out of the government? Like for us here, we have an RCC working group that's doing a great job. We've supported them in putting together a database of messages that has been shared with different actors that are using, even the private sector. We have VMO here that has also been using this database, but really, there has been that where that issue of trust and information coming from the government is supposed to be the most trustworthy, and we've really struggled with that. What was your experience? Yeah.
So Malaysia has had a very, I would say, a good experience with communication on public health matters, right? I think one of the first things that, I was very strongly advising is that you must have a figure that is consistent, somebody who's going to consistently come out and speak to the public, and must be someone who's not a politician, a health practitioner. And it was the Director General of Health, who is one of those most I think he's probably the most trusted human being now in Malaysia. So, he would come out spot on every day at 5 o'clock on all social media channels, on national television, on radio, on every possible means of communication to share, precise numbers of what was happening, how many people were in hospital, how many beds do we have left, how are we doing? And I think, he eventually, there were millions of people basically glued to the television or their phones waiting for 5 p.m. So, the messenger is as important as the message, especially in an environment where maybe, politicians are less trusted. All right. So that's number one. And then, his communication team and he himself being very, very media savvy, social media savvy, really helped, to be out there. And, with Facebook and other social media, there's, a lot of comments and stuff, right? But addressing them then, to say, no, this is the information, here's the data. So transparency is key, particularly when you're dealing with pandemics. The problem, though, is that once the pandemic is under control, how do you maintain people's interest and commitment to compliance to public health measures? Because there's fatigue. Everybody is tired of staying at home and, keeping a social distance and wearing a mask. In Malaysia, it's mandatory to wear a mask in public places. So I think, that's when you need the repeat messaging, but also understanding the mental health pressures that people are going through. I think that is one area perhaps globally, as we face this pandemic, people underestimate the amount of mental pressure and health, mental health pressure that we all go through, whether, you are affected or not. So I think, very careful use of social media and public communications, consistency, transparency, and a face they trust.
Let's pick up on a particular issue that has been a feature of this pandemic and really of the year, which is misinformation and the infodemic. And I mean, the CDAC Network has done work on rumor in humanitarian contexts and years past, and there is a really great report that I recommend that's on the website. But I think now there are overlapping issues around deliberate miscommunication, but also just the amplification of incorrect information. How do you counter that effectively? And are you seeing that being an impact? And I also just wanted to pick up on one other issue that maybe we don't have time to touch on, but the issue of language and having content in the appropriate language is a real issue. It's not the case that if you have access to the internet, you have access to all the information on the internet. If English is not your first language, and the figures on the amount of content in many languages is really sobering. But let's talk about this issue of, we've had a question in the chat. It's a huge challenge, mismail and discommunication. How can we use digital communications in a principled manner to sort of correct those imbalances? Anybody can pick that one up.
Okay, I definitely want to pick that up. I actually wanted to, I watched a couple of days ago a webinar for the presentation of a report called called Tinfoil Trust, Mapping Conspiracy Theories During COVID-19, done from Media Measurement. I'll put the link here. And it was actually extremely interesting because they did a mapping of the different conspiracy theories, where they were coming from and how they specifically spread. But one of the things that was fascinating is one of the findings of this research was that the role, especially of extremist voices within the conspiracy theories and the spread of those theories, it's increasingly higher where there is a gap, where there is a hole in information left by institutions. So there's, especially at the beginning of the emergency, there's been a lot of confusion and a lot of public, if you want, public information provided by governments were contradicting and were, uncertain because the situation was uncertain, right? And so that created this kind of situation where people felt that they couldn't get the right information from the official sources. Just to give you an incredible example that they made in the report that I thought it was absolutely incredible because I never thought about this in this term. There is a website that it's one of the very few websites that has been completely banned from Facebook because of the amount of incredible misinformation that they spread through the platform, specifically related to COVID-19. This website, even with being banned from Facebook, has more or less around 48 million interactions. The CDC website and the WHO website together have around 12 million interactions. So that gives us an incredible value of the issue that we have with trust. Because here we're not talking about something that is unknown. That website is specifically well known and also banned from social media. Still, it does get this amount of interactions, right? That means that there is a hunger for certain type of information. There is hunger for understanding what to do and how to do it. And I've done, I'm doing these days a lot of research and work with some big humanitarian organizations on what does that mean for the way we use social media and interact on social media. But I think that people forget that misinformation, disinformation, and all sort of fake news, if we want to call it that way, do land where there is a void, do land where there is a lack of reliable information that people trust and can use. And I think that that is where the trust issue becomes absolutely important. If people have not trusted their politicians for years and years, now where there is a public emergency, so the public emergency is managed by politicians, you have an issue because people do not trust that. When Yamila said you have to have a public face that it's not a politician, it's a very important thing. It gives us an idea of where we stand when we're looking at, using public health measures at the national level, for an entire population, where we stand with that ability of that population to feel that their, leadership is leading them in the right direction. And that is the same thing that is happening and was happening, and it's still, going to be happening probably within the humanitarian system, which is if you haven't built the trust before, now it's going to be really hard for you to use digital tools to do community engagement and to do, and to involve community into your programs. It's not a Facebook page that is going to allow you to do that. If your Facebook page was empty or used as a broadcasting page for the past 5 years, today it's going to be very hard for you to transform it into a place where you can ask questions and receive feedback and engage communities, and communities come there because they trust you and all of that.
Yeah, so to add to that, and this was great, I picked up on a lot of different points that you made there, Nahi, and that are very relevant also to our context. I want to go back to a little bit to one of the principles that we have, which is to really understand the ecosystem, the existing ecosystem. And with CDAC, what we've done, how we even started this is we did a situational analysis that told us what the landscape for communication and community engagement in our country is already. What are the gaps, those empty spaces that you were mentioning, Anahi, and how do we make sure that we set up platforms, we set up mechanisms, including our working group at the moment, the government's RCCE group, that will help us to fill those voids. The West African region in general has set up a website where, the issue of trust, we've used also champions like artists, community leaders, international leaders that have put together messages that are on that platform where like Red Cross volunteers, community liaisons can go and pick them up and then go into the communities to be able to address this. Because what Dr. Jamila was saying is also really true. The pandemic we didn't know how long it was going to last. And at the moment, people are tired. Like I tell you here, people, we got to a moment where people were like, this disease doesn't even exist. We don't really believe in it, especially in places where there were regions where we didn't have any cases, where people were like, nah, we don't think this really exists. We're more hungry even, that is food that we want. We don't want, like this thing, we're not seeing it, so it probably doesn't exist. But to keep going and keep, repeating the messages and using people that people trust, like, even if it's outside of the government, like artists and, celebrities and other champions of the cause as well.
Dr. Jamila, do you want to address that one before we move on? Or
no, I think one of the things I want to share with you is in Malaysia, we take fake news or misinformation very, very seriously. In fact, it is you can be charged for spreading misinformation. So every day they use Telegram, one of the kind of messaging portals where there is a team actually monitoring social media and messaging to see what might be misinformation, and it's immediately reported onto that platform. So the public is made aware on social media, on Telegram, on other channels, on what is misinformation, and whoever spreads it actually can be charged.
Yeah, it's fantastic. I think well, so I've just been looking at the chat, and I just want to encourage those who are watching or listening live to add your questions. But we've had some fantastic questions in the chat, including what are the digital principles, which is an excellent question. And what I'll do is say that the website is digitalprinciples.org if you want to go and have a look. And also that the CDAC Network website can be found at CDAC network.org. So do go and have a look if you have that question. And there's a really spirited conversation happening in the chat, which I enjoy, and please do add questions for us. I wanted to, there's a war in my head about what I want to ask first, but I'm going to start with this one. So we had an excellent question come in from the RSVP forms, which I'll read to you. So information provision is just one element of communicating with communities. An important element is to involve affected people in decision making. So this was just mentioned. Often this is interpreted as feedback that helps to adjust ongoing programs. Do you have examples of where digital technologies have been used successfully to engage people in genuine decisions about project design or planning or implementation? And how did you ensure fair representation in that, so a balance of different people's views? Anybody want to pick that one up?
Maybe not related to COVID, is that okay?
Absolutely.
Yeah, well, at the IFRC, every 10 years, I mean, we come up with what we call the 10-year strategy. And when I was tasked to look into this with the team, one of the things I asked was, how do you actually, how many people give you inputs when you write a 10-year strategy? And I learned that it's not many people, not many national societies or people. And then because I had done the World Humanitarian Summit, which was a massive consultation process, my team was so clever. They started to produce games on WhatsApp and gamified the consultation to ask, our membership what were the biggest challenges that they felt the organization needed to address. And you won't believe it. There was, I think, like 200,000 responses from young people, even from countries that didn't have WhatsApp. They would bypass it, use VPN to give feedback. And that formed the basis of the 10-year strategy. So it wasn't something that we cooked up. We felt, well, these are the important things. It was really bottom up from 200,000 responses and lots of papers and all that. So it was even gaming it using WhatsApp as a tool. So I thought that was quite an interesting experience that we had.
Thanks, Jamila. That also puts me in mind of the State of the Humanitarian System report and the work that Ground Truth did to try and bring in community views to that. I have a theory, which is that the humanitarian sector sometimes is further ahead with some of this accountability and sort of feedback and stuff than development, because we have built-in iteration, because we pack up and go to the next emergency sometimes. And so we have a chance to pause and reflect and then try again something different next time. So it's just a observation. Does anyone else want to comment on that question about feedback before I throw in another one?
Sorry, Cassandra.
No, yeah, okay. Yeah, this is same thing happening here. Yeah, we've had members of the working group that are doing research on the impact evaluation of their programming right now is done through research via WhatsApp, where they will actually go in the sites, the IDP sites, and even train IDPs themselves in doing that, in collecting data via WhatsApp that is going to inform the impact evaluation of the programming that they do, and also the changes that they will bring into the programming. And it's not only just going and collecting the data. Ground Truth Solutions is also doing, and Reach are also doing amazing work here, collecting feedback from communities. It is also closing that loop whereby they will go back. It's not only going to inform the writing of humanitarian documents and the humanitarian programming cycle. They're also going to go back to the communities and say, here is what we've collected from you guys. What do you recommend that we tell the humanitarian community in order to improve the programming? Yeah.
Anahi, did you want to say something?
Yes, I wanted to give you one example that I thought was very interesting. And in my naive world, I thought it was going to be replicated all over the world. It didn't, but it was still it's still a fantastic example. So when I was working for Internews in South Sudan in 2015, 2016, in both years, we worked with UN OCHA directly to involve communities into the drafting of the humanitarian needs overview and of the humanitarian response plan. And I thought it was a fantastic, a very kind of like fantastic first test with doing that, because basically, being South Sudan, you couldn't use a lot of very high level technology. So we use radios, but through radios, we had live programs. People could call in, people could, we'd explain to them what the humanitarian needs overview is, what the humanitarian use it for. This is about your needs. And it was a fantastic and incredible experience to see how much people had a very good understanding of what their needs were and how they wanted those needs to be filled. And it was also very interesting to see how often the strategy of the humanitarian community was very different. Very often the humanitarian community would look at emergency relief, food, shelter, water, and all of that. Very often the community, even within an emergency, was looking into education, longer term infrastructure, connectivity, and this kind of stuff. So I thought it was a very interesting way to kind of like look the community into that. And there was something else I wanted to say, but it went away. Yes, no, there was one thing that I wanted to say, which is the risk of going digital and using a lot of digital tools right now in a way that it's like we only have digital tools to communicate with people, which is that in my experience, humanitarian organizations were already suffering before COVID of an overload of information. Every humanitarian organization collects an incredible amount of information, and very often the one that it's actually used is a 10, 15%. And with digital tools, there is the tendency to collect even more information and to get even more information in because it's fast. And the risk is that you get even more overload, and then you end up with a ton of information that altogether doesn't tell you anything. So I think that there is a very strong need, especially now with COVID and with the use of all of these digital tools, to think about what is the information that you actually need when you use the digital tools. And a lot of the times you don't need any information to use digital tool. You don't need to collect it, you don't need to store it, you don't need to keep it. So I think that it's important that this aspect of going digital, and the digital principle in this help. So I think that is where I actually see another very important point of overlap in between the two.
But Anahi, what you mentioned, it really is sort of being replicated, right? Because the HNO and HRP that you mentioned are being really done here this year. With data that is being collected at the community level. And I know that in the Central African Republic, they've done it. It's, I know, right? It might have taken a little bit of time.
Everything. I claim the merit.
There you go. It might be taking a little bit of time, but it's coming.
All right, I like a rowdy webinar, but we can't always hear you when you're both laughing at the same time. So I could do this all day, but we are actually almost out of time, and I have at least 2 excellent questions that I wanted to ask. So what I will do is I will follow up immediately and pester you on social media and ask you to answer them there instead. So rather than open up a new topic right now, I'm going to hold those and instead ask each of you if there's something that you would like to share, this historic meeting of the CWC and principals communities. Is there one parting thought that you'd like to share before we wrap up? So Dr. Jamila, why don't we start with you?
I think the one thing I would say is, let's not preach to the converted, right? These principles are so critical. We are the community that are passionate about it, about community engagement and communication. I think we've got to spread the net wider.
Sandra, let's hear from you.
Yes, thank you. And thanks for this great panel. I think the one principle that I would like for us to leave with is the last one, to be collaborative. We really, really need to continue within that route. And, you know, starting with this forum, that is a great example of collaboration, and then bringing other actors to this platform and platforms like this as well. Thank you.
Thanks so much. And Anahi, let's close with you.
I would just say, you know, go back to what Yamila said at the beginning, is like, it's going to be all about localization. It's going to be all about build with the user and understand the existing ecosystem. That to me, those are the two most important principles, because it's all about that. If you start with that, you have done already 90% of the work.
We'll just give you a teaser of one of the questions I was going to ask, which actually came in on the chat, is around, you know, some of these principles. If you look at them, design with the user, understand the ecosystem, they need time before you start doing something, which in the humanitarian sector is hard if you don't get there before the emergency happens. In the development sector, it's often the proposal. You're writing for a proposal without the funds to go and start doing some of that work. And so I'll just put a teaser here that one of the questions I'm going to ask you later on is, how do we build understanding of the need for preparedness, funding and resourcing, so that we can build these networks, these trust networks and these relationships, this capacity, this understanding of the context ahead of time, and be more ready to implement. So check out Twitter for more on that conversation. And for those who are watching live, we've added everybody's social media handles in the chat. And so I just want to say before we close out, where you can find some resources. So to share with our humanitarian sector friends and reshare with our digital development friends, there are resources on the Digital Principles website that will help you integrate the digital principles into your programs, which was going to be my final question. And so if you look at the resource tab of the Digital Principles website, which is digitalprinciples.org, you can find case studies, how-to guides and reports to learn how members of our community have designed programs and tools with the principles in mind. We also have evaluation tools such as our maturity matrix to help you align proposals with the principles. And we have increasing numbers of donors who now require that throughout all the phases of the project lifecycle. And watch this space because there's more coming. If you'd like to give us feedback on the webinar, if you have topics or ideas to share or want to reach out, you can find us at digitalprinciples.org or on Twitter at digiprinciples, that's DIGI principles, or you can use the hashtag digitalprinciples. On the CDAC Network site, you'll see a decade of resources on communicating with communities, including research, toolkits, case studies, reports from emergencies all over the world, and a page with resources specific to the COVID-19 response, which I really recommend because it is encyclopedic. We'll drop that link in the chat for you as well. You can also register to join the CDAC Network annual forum, which this year will reflect on the reality of inclusion and power in this digital age. Accountability in the age of the algorithm will be held online on the 28th and 29th of October 2020, but be warned, one of the days will be hosted, unfortunately, by me. So find out which day to avoid at the link that's also going into the chat. And you'll find the CDAC team on Twitter at CDACN, CDACN. Finally, I'd like to thank our guests, Tansri Dr. Jamila Mahmood, Sandra Zerbo, and Anahi Ayala Yakuchi, and our partners for this webinar, Marion Casey Maslin and Murray Garrett of the CDAC Network. Thank you all so much for this. It has been such a joy. And to all of you, whether you're listening live or later, thank you so much for joining us and for all of your questions. Thanks very much, everyone.
Bye, everyone. Bye, Sandra. Bye, Nahi.
Bye, everyone.
Take care.